We do a lot of research across campus that may be relevant to your own research that you don't know about. And sometimes it's kind of hard to find people across campus. So like Research Day really gives us the opportunity to learn about like what type of research is being done across campus and find maybe new collaborators that can help like build new ideas and get more funding to support our research mission.
Well, interdisciplinary research is kind of the epicenter where real solutions are made for real world impact, right? So we have to start pulling ourselves out of our silos, working together and thinking about actual real world problems. And so when you think about interdisciplinary research, let's take it to some of the greatest challenges facing our country, like mental health, right? It's not going to be solved just by someone in a lab, right? It's got to bring the lab to the community setting and working together.
My lab is interested in addiction, and we use the fruit fly, Drosophila melanogaster, to model addiction. And the reason why we do that is because it turns out that many genes that are involved in human addiction are conserved in flies and also affect how they interact with drugs of abuse. And the beauty of Drosophila is that it's a genetic model organism, so we can really learn how these genes interact with other genes, and we can identify new pathways, how these genes work, and therefore we can identify more targets for therapeutics.
I talked about the change in addiction culture in the United States, and particularly looking at how research can inform moving patients from outside of the healthcare system for addictions into the healthcare system for their addiction care, and also how research can be a very important component of that. We often think of research as a bench science or rat brain research, but research actually can be in clinical trials. It can be in how to change or a culture of a healthcare system, or how to improve the implementation of an evidence-based idea into healthcare.
So what I talked about today was one of the real challenges for fellowship training is always going to be funding, because there's no, obvious source of funding, and it has to come from somewhere. We also applied for HRSA, Health Resource and Services Administration funding. And so we were funded in 2020 for $4 million for 5 years, and in 2025, $3 million for another 5 years. So that by the end of this 10 years, from 2020 to 2030, we will have brought in, enough support to train 35 fellows without having the cost of that training fall on the U or the VA, and also to support faculty and administration for the fellowships.
My area of clinical and research focus is advancing neuromodulation intervention in the population of women, pregnant and postpartum women with substance use and mood disorder. So my talk today is focused about reviewing current evidence and new innovative data in terms of advancing the use of transcranial magnetic stimulation, which is one of the neuromodulation intervention in addressing depression and substance use during pregnancy.
So my talk was focused on how we can measure sort of the culture of integrating behavioral health services with primary care services. So primary care and behavioral health are often treated as silos, but we have a lot of interest in bringing these disciplines together to kind of reduce barriers to treatment. And my research was really focused on how the VA is doing that, particularly for veterans who are homeless.
I gave a brief talk about different sources of funding that I've been able to take advantage of over the past several years to support interventional psychiatry research, and hopefully provide some lessons for others who might be able to diversify their funding sources.
Today we talked about the Elevate Center, which is a center at the University of Utah that is aiming to reduce maternal morbidity and mortality from substance use disorder in Utah.
I talked about an implementation study looking at the implementation of a postpartum depression prevention program across the entire UHealth system, and also with 6 Utah rural health districts.
What I spoke about today is, in the challenging world of research funding, how do you find sources to support your funding that aren't the NIH. And I think most of us think about the National Institutes of Health as kind of the premier and some people the only place to go to get funding. What we spoke about today was, how do you work with companies specifically to try to help support research funding in the university?
I think what a day like today can do and help catalyze is that this is a day where there are no barriers to access. We are saying, please, if you have any interest, wherever you are on the training pipeline, on the interest in mental health, brain and behavior pipeline, come and join us.